Its latest briefing on the conflict in Sudan, the UN Office for the Coordination of Humanitarian Affairs said acute malnutrition was spreading fast and resources depleting even faster. The situation is especially dire in the battlefront city of El Fasher in North Darfur State, where it is reported that trapped civilians are now surviving on animal feed. The city has been cut off from humanitarian assistance for more than 16 months.
638,000 people are in IPC 5, which is significant catastrophic food insecurity, more than half of the global number. Acute malnutrition surging, hotspots Darfur, you've heard this before, the Kordofans, and also Khartoum, the capital.
To make matters worse, the Darfur region is also battling a cholera epidemic that has infected more than 100,000 people, according to Sudan's health ministry. Earlier this month, Doctors Without Borders said it had killed 40 people in Darfur in just 1 week, calling the outbreak more than an emergency.
Diseases have no borders, and if there's a cholera outbreak in El Fasher and it doesn't care whether you're in uniform or a civilian, it kills whoever it sees. And that we needed to get in. We've got 70 trucks, WFP, UNICEF, and WHO trucks waiting at in Niala, South Darfur, to get into El Fasher.
The UN says the conflict has made travel within Sudan extremely difficult, forcing humanitarian aid to go from Douala in Cameroon through Chad's capital N'Djamena and onto several more cities before arriving at the Adre border crossing into Sudan's eastern Darfur region. More than 4 million people have also fled the country, with many seeking shelter in neighboring Chad. But the Central African country is itself fragile and struggling to support 1.4 million refugees. The UN is calling for sustained improvements in aid access and more funding to reach civilians in Sudan. Devin Bidi, CGTN.